Good afternoon, everyone. Today, I'm announcing another step forward in Alberta's vaccine rollout. Starting tomorrow, all teachers and childcare workers in the province, as well as support staff in the schools, will be able to book appointments for the COVID-19 vaccine. Since December, we've committed to getting doses into the arms of Albertans as quickly as possible and to protecting the most vulnerable and at-risk individuals by giving them the vaccine first. We've kept those promises. And as of today, we've administered over 1.64 million doses of vaccine across the province. This means that 37% of Albertans over the age of 16 have gotten their first shot. And that's more than 1 in every 3 people, which is a remarkable accomplishment. And we've gone further than other provinces in providing double doses, the second doses, to the very elderly, particularly those who are resident in long-term care. Thank you to every Albertan who has chosen to get vaccinated and to every healthcare worker that's put shots into the arms of over the last 5 months. No matter what age group you look at, the vaccine numbers keep going up. 83% of Albertans over the age of 75 have now received at least 1 dose. 77% of those between the ages of 65 and 74 have gotten their shot. Nearly 60% of Albertans aged 60 to 64 have gotten their first vaccine, and the list goes on. Despite that, the recent surge, despite the recent surge in overall cases, we're seeing lower case rates, hospitalizations, and fatalities in those age groups. And it's for one reason: vaccines work. More vaccines are arriving every day, and we're expanding the rollout to match. Starting tomorrow, all teachers in kindergarten, elementary, junior and senior high school will be able to get their shot, as well as childcare workers and school support staff like bus drivers, caretakers, educational assistants, and others. I know that many already have, because we started with prioritizing older ages and those with serious health conditions. We estimate that over 60% of teachers and childcare workers and support staff in the schools have already been able to obtain the vaccine. However, today we're announcing that the others can join them. This has been a very long and difficult couple of years for both teachers and kids. Our next generation is likely going to be the most tech savvy and are used to learning online, much more so than previous generations. But the glue that has kept learning going and our kids focused has been our teachers. They've not only developed ways to engage and get through the curriculum that our kids need to succeed, but they've served as unofficial counselors, sometimes as sanitation supervisors, tech consultants, and sources of comfort and routine in a world that often has seemed turned upside down by the pandemic. So I want to thank every teacher and everyone in the education system for their dedication. You've worked to keep schools safe and keep students learning, even when going online and temporarily closing was the last and best option. Now, we know that schools are small communities and they run only with help from people such as education assistants, bus drivers, and custodians, and that is why they too can start booking appointments tomorrow. We are operating on the honor system, so no proof of employment will be necessary. We're watching our vaccine supply carefully and expect to open phase 3 to bookings for the general population over the age of 16 in the very near future. Stay tuned for details. But by vaccinating teachers and staff, we'll help to further protect classrooms, children, and families across the province. That's also why, starting tomorrow, childcare workers will also be eligible to get the vaccine. This includes all staff working in licensed childcare programs, such as daycare programs, out-of-school care, preschool programs, and family day homes. They'll be able to take the next step to keep themselves, their loved ones, and students safe. Alberta's vaccine rollout is amongst the best in Canada. Our province is regularly amongst the country's leaders in percentage of doses administered. The fact that we focused on second doses for those in long-term care and other seniors congregate care meant that we were able to relax a little bit the visiting and personal support protocols around those senior centers. And we're using every tool in our toolbox to get vaccines out the door. AHS clinics, pharmacies, and doctors' offices are helping vaccinate people as quick as we can. I'd also like to confirm that despite the recent delays in the Janssen vaccines, Alberta will also deploy 20,000 additional vaccines, that is to say doses, to support the regional municipality of Wood Buffalo and the town of Banff. The age group eligible for immunization in these communities will be lowered to 18 years of age and older in these communities. When the Janssen delay was announced on, I believe, Friday, we committed to the people of Wood Buffalo and Banff that we would find another way, because initially we had committed that that was the source that would go to them. And I'm pleased to say that we have been able to keep that commitment. This vaccine is our ticket to getting out of the pandemic and back to normal. But right now, it is not enough. Cases and hospitalizations are rising faster than our vaccines are arriving. We need to bend the curve in the next few weeks, which means we need to, folks, to follow the rules. On that point, I was very disturbed. Actually, I was angered to see large numbers of people gathering this weekend at an event in Bowden in flagrant violation of the restrictions in place and of any common sense public health measures. I know this event was not organized by the Canadian Professional Rodeo Association, who has been working closely with the government to bring a safe return to this amazing sport this summer. And I was heartened to see the association representing rodeo publicly disavow the event in their statement earlier today. I thank them for doing so. That event was organized by people who simply don't care. Apparently, they don't care about COVID, and apparently they don't care about the sacrifices that millions of Albertans are making every single day. Apparently they don't care or are somehow choosing to ignore the hundreds of their fellow Albertans in hospital and intensive care beds right now, battling this disease, and in some cases fighting for their lives. It is as astounding as it is aggravating that 14 months into this, more than 2,000 deaths in Alberta alone, that we still have many people in the province who don't even believe that COVID is real, who think that some kind of big government conspiracy or hoax. The reason we are at this critical stage of the pandemic in Alberta, with record high daily case counts and intensive care numbers, is precisely because, for whatever reason, too many Albertans are ignoring the rules we currently have in place. And let me emphasize that Alberta has essentially the same rules as our neighboring provinces, British Columbia and Saskatchewan. Their case counts are going down while ours are going up. This is incredibly frustrating for all of us. And that is why I am imploring all Albertans to take this seriously. I said on last Thursday, that if Albertans are not willing to do what's right, even though it's hard, then we will be forced to take further steps. Given the issues we saw this weekend and the record high cases reported, we are developing a package of stronger public health measures, which I expect to announce tomorrow. The next few weeks are critical. If we bend cases down, the vaccines will be able to catch up with the variants. But it's up to each of us. Our actions will determine whether we get a summer where we can enjoy lighter restrictions and low spread thanks to vaccines, or whether we're still stuck battling the spread of this virus. If you choose to ignore the restrictions that have been put in place, just know that you're setting everyone back. And we all want to see this pandemic over. I know that the debate over this has been divisive. It's divided families, friends, communities, workplaces, but it's time to pull together, because what matters is what's happening in our healthcare system. And if these numbers continue to go up at their current speed, we won't be able to cope in our hospitals. So whatever your personal views are about COVID or the government or any of this, please put our healthcare system first so we can offer beds and care to people who need it, especially if they're fighting for their lives. We don't get to the end of this without everyone doing their part. So please follow the rules that are in place and get vaccinated when it's your turn. And with that, I'll invite Dr. Hinshaw up in Edmonton to provide today's COVID-19 update, and then we'll be happy to take your questions.
Thank you, Premier, and good afternoon, everyone. Over the last 24 hours, we have identified 2,012 new cases of COVID-19 and completed about 15,000 tests. Our positivity rate currently stands at 13.2%. We have identified 1,900 additional cases of variants of concern in the last 24 hours. Variants currently represent about 64% of our active cases. For the previous week, the R value for the province was 1.12. This includes 0.99 in the Edmonton zone, 1.16 in the Calgary zone, and 1.18 for the rest of the province. Numbers above 1 mean we continue to grow. There are currently active alerts or outbreaks in 808 schools, which represents 33% of the schools in the province. There are now 658 people in hospital being treated for COVID-19, including 154 in the ICU. We have added the town of Okotoks and Rocky View County to our hotspots list today. Both of them have met the threshold, and so additional restrictions now apply in these locations. Sadly, I must announce that 4 new deaths were reported to Alberta Health in the last 24 hours. As always, it is critical to remember that these are not just numbers. These are people. Every one of these deaths leaves a hole in their families, their circle of friends, and those who cared about them. My deepest sympathies are with anyone grieving the loss of someone they loved. I know teachers and childcare workers have been patiently waiting their turn to roll up their sleeves and will be booking appointments first thing tomorrow morning. That is a good thing, and I thank you for doing so. I also want to reiterate the importance of everyone who is eligible to choose protection for themselves and those around them. I know it can be confusing to remember who is eligible, so I want to remind everyone, if you are 50 or older, you can get the vaccine right now. If you were a First Nation or Métis person and 35 years of age and older, you can get the vaccine right now. If you are a healthcare worker, firefighter, caregiver, or anyone else listed on our website, you can also get the vaccine. If you're now eligible or have been eligible for some time and are still on the fence of whether or not to make this choice, I urge you to make the choice to do so today. This choice is the best protection available. By being vaccinated, you will reduce the risk of COVID-19 not only for yourself, but for those you love. You will help to reduce the spread of the virus in our community. The more of us who choose vaccine, the closer we get to replacing the currently needed protection of public health measures with the protection of vaccine. Thank you, and we'll be happy to take questions.
Okay, we'll now go to the phones for questions. We'll do 2 questions each, either 2 off the top or 1 question and 1 follow-up. Operator, can you please put through our first caller?
First is Jocelyn Laidlaw with CTV. Go ahead, Jocelyn.
Hi, thanks, Dr. Hinshaw. I appreciate you taking my question today. There's a bit of a setup for this, as I asked on behalf of one of our reporters. So we've been obviously told for a year now that indoor social gatherings are a major source of COVID spread. That's one of the top dangers. Obviously, we've been told not to have indoor gatherings like children's birthday parties. So 10 or 12 kids gathered in a room for a party are a dangerous source of COVID. However, of course, we continue to send our elementary, in particular, children to school. Classes of 20 to 35 are not a problem. So the question for you is, how can parents be expected to reconcile what appear to be 2 entirely inconsistent or, in some views, illogical approaches and recommendations? What do you say to parents who say, why can't my child have a birthday party, for example, and yet it's safe to send them to school when we have more than 800 schools with infections or outbreaks today?
Thank you for the question. We know that schools have not been a driver of spread in the community. However, they are put at risk by high community spread. So I think it's really important to, first of all, remember that when schools are operating with all of the safety protocols in place, those protocols limit the risk of widespread transmission from one student to many. However, again, when there is widespread community transmission and there are many introductions in schools, that spread can happen on occasion. The difference between schools and birthday parties, one is that in a school setting, you have the exact same group of kids in that cohort model who are gathering together on a regular basis, and they are doing so for the benefit of their development, for their education, which benefits not just those children, but it actually benefits all of us as a societal good. We also know that with the masking requirements in place in classrooms and the requirements that children are wearing masks at all times, and the one exception being when they're seated and quiet, and in some schools even then the students are wearing masks, that continuous use of masks is one mitigating step. We also know that there are requirements for daily screening of not only students but staff and teachers. So if someone is feeling ill, then they either don't attend at all, or if they attend and it's identified that they're not well, they're immediately sent home, and all appropriate precautions are taken to prevent spread. So it's with all of these precautions in place that we have been able to collectively, including hard work on the part of parents, students, teachers, and staff, to mitigate the risk of spread in school. However, it's certainly concerning because the numbers in the community, as they grow higher and higher, do increase that risk of exposures. At a birthday party, however, typically the interactions are unstructured. Typically children are interacting with each other in close proximity. Typically, again, there's, depending on the birthday party, but often mask use would not be enforced. There's no framework within which to ensure that all of those mitigating measures are followed. And often there's mixing of children between different cohorts. So again, we know that right now the most important thing is to follow the public health measures in place to bring down community transmission so that we are not putting schools at risk and we're not increasing that exposure risk when that community transmission spills into schools and starts impacting them.
Operator, can you please put through our next caller?
Next is Jeff Slack with 660 News. Go ahead, Jeff.
Hi there. Thanks for taking my question. This one's for Dr. Hinshaw. We are seeing unprecedented ICU numbers and breaking new records in this third wave. There are healthcare workers worried about the number of beds available to treat these patients. And last week, AHS did issue its triage report in case the situation comes to a point where we need to pick and choose people. Now, from your perspective and the information that you have about COVID in the province, should we be concerned and expect that in this third wave, the healthcare system will collapse?
That's really in our hands in terms of the spread that we're seeing over the next little while. We know that as cases rise, there is a bit of a lag time between when cases start to go up and when hospitalizations and ICU numbers start to go up. What we need is to bring our cases down as sharply as we possibly can to limit the possibility that we could see the numbers of COVID-19 patients exceeding capacity. I know that Alberta Health Services has been working very hard to make plans for how they would expand should they need to, as we anticipate there will be an increase in the coming weeks in ICU cases. But the one thing that all of us can contribute to is dropping the spread as quickly as possible so that that subsequent impact of ICU and hospitalized cases does not reach that point where it overwhelms the system.
And if I could just follow up, can you hear me? If I could just follow up with just a little bit more context, we should be concerned about that, and that is the main reason why we continue to implore Albertans to follow public health measures. I totally agree with Dr. Hinshaw. Just to give you some statistical context here, right now, the 14-day lag between active cases and ICU admissions is about 0.8%. And that number has been coming down, likely because we have been vaccinating an increasing number of people who might be vulnerable to hospitalization. So based on the current total case count of 24,000, if you were to apply the current ratio of 0.8%, we could expect to see about 190 people in ICU on May 18th. We've worked very hard with AHS to expand ICU capacity with various different protocols. Unfortunately, some of that does involve delaying or non-essential procedures such as surgeries in certain health zones. But with those measures, we can provide for, we estimate, 425 staffed functional ICU beds. So at 100, if we could expect 192 roughly ICU admissions 2 weeks from now, That would be half of our defined maximum capacity, but we don't want to go anywhere near that maximum capacity because it involves canceling more surgeries. It involves enormous stress for our frontline healthcare workers. It involves risks that we should not be prepared to take. So I would say we're not in that we're not facing the kind of scenario that you're describing right now. And that is why it's desperately important that we start to flatten that curve so that we don't start to move higher than that number.
Jeff, do you have a follow-up?
Yes, I do. Thank you. This one's for the Premier. Alberta currently leads the country in active case rates, and apparently the United States too. You announced restrictions last week, right when we broke a new record, but now you're saying, well, those aren't good enough, so we need more, which you're going to announce tomorrow. Now, with all due respect, at this stage, why should Albertans have faith in your leadership to guide us out of this third wave when your government essentially got us to this point right now?
Well, the virus got us to this point right now. One of the things I find regrettable about COVID from day one is this tendency to try to politicize it and turn it into a blame game. The reality is, as I've said, Alberta has basically the same policy setting as British Columbia and Saskatchewan. Their numbers are going down, ours are not. There are probably a whole lot of factors in that, but we have to respond to the numbers. And every government, certainly in North America and Europe, I mean, the governments in Asia took a totally different approach. They sealed off their borders immediately, as did New Zealand and Australia. That's a decision that Canada's government did not make last March and February. And so we've been struggling, like North America and Europe, to respond as this thing unfolds. And what we are seeing in recent days strengthens our concern that previous measures that have been put in place have not been adequate to flatten the curve in Alberta. So, you know, if all you want is consistency, we could have, I guess, tried a consistent approach of absolutely total lockdowns for months upon months. Some other jurisdictions have done that. The costs of that have been enormous. Or we could have taken the approach of some U.S. states and consistently left things wide open and had an unacceptably high death rate. Instead, we have consistently stuck to the same goals, which have been to protect lives, to protect the healthcare system, but also to minimize the negative impact of restrictions on our broader social health. I think generally we've done quite well with that. If you look at, for example, the per capita COVID death rate in Alberta versus that of Canada, North America, or Europe, I think that this is a confirmation that our middle ground approach has been successful. But right now we are facing a very serious wave, and we will take whatever measures are necessary to address it.
Operator, can you please put through our next caller?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi there. This is a question for the Premier. How concerned are you that waiting until there are more than 2,000 cases a day will mean that whatever you need to put in tomorrow will be more severe and will need to last significantly longer than if you had acted even just a couple of weeks ago when cases were a lot lower?
Well, James, we've been acting for months. I'll remind you that there are entire categories of businesses that have been completely shut down for 14 months. It has been illegal for families to gather outside their own household for 5 going on 6 months in this province. The freedom of worship, a constitutionally entrenched fundamental freedom, has been significantly impaired for the better part of a year. We have taken extraordinary measures, and so we haven't been waiting. We've been one of the reasons that we haven't faced the same kind of pressure in the hospital system as some other provinces to our east is because in the winter and spring, we were very careful in tying gradual and modest relaxations of public health measures to hospitalizations, and to ensure that we had capacity if we moved into a third wave this spring. So, and finally, we have been acting all throughout the year, but especially in the last few months, to continually increase our capacity, we've taken our capacity to do contact tracing from about 300 cases a day a year ago to upwards of 2,500 cases a day, perhaps more. We've expanded our testing capacity. We've obviously stockpiled PPE. We've done everything we can to bring on board more workforce. We've expanded our maximum capacity in the healthcare system as much as humanly possible. We've spent billions of dollars in doing all of that as well. So we have been acting. But right now, unfortunately, we see that even though our public health measures are very similar to those of our neighboring provinces, our cases are going up while theirs are going down. There may be a number of reasons for that. One may be a broader non-compliance. We have a younger population, and as you know, younger age cohorts have been those most likely to be infected right across the country. That's not to blame anybody. It's just a demographic reality. We also have a higher labor force participation, which means more people, as a higher percentage of our population that's out in the workforce and public-facing jobs. Climate may also have something to do with this. Look at Texas, that opened up completely, I think on the 7th of March, at a lower level of vaccination than we are at now. And their numbers have plummeted. Their case numbers and hospitalizations have gone down, while ours have gone up with very significant public health restrictions. Again, that may in part be a reflection of climate and other factors. So there's a lot of factors in this, but the bottom line is, as we've said, we will do whatever it takes to protect the healthcare system, and that is why Cabinet is discussing today and tomorrow additional restrictions.
Do you have a follow-up, James?
Yeah, so I mean, the public health measure experts were warning of this coming wave a few weeks ago. I mean, pretty much exactly what they described is coming to pass. So I mean, you talk about the blame game. Alberta has the exact same access to vaccines, the same ability to put in policy measures. I know there's differences between provinces, but of course, we would respond to the local scenarios. You're talking about responding to the numbers, but it seems like you haven't been. So I'm just wondering, how can you not shoulder some blame for things getting this out of hand? You could have acted earlier, but you didn't.
Again, I reject the premise of that, James. We have been acting, as I've said. I know that I find it peculiar that some of the media and commentary suggests that Alberta has had little or no restrictions. Again, it has been effectively illegal for grandparents to visit their grandchildren in this province for half a year. Thousands of businesses have been unable to open their doors. Indoor social gatherings have been banned since the first week of December. Mandatory mask mandate has been in place. Sweeping, unprecedented restrictions have been in place. Restrictions that have been effective in neighboring provinces at flattening the curve of this third wave. So we've been clear from the beginning that our approach has not been to impose indiscriminate restrictions on every facet of society that could only further fray compliance. I've made this point repeatedly, that what matters is not the stringency of restrictions, but compliance with them. And if you have a compliance problem, as apparently we do here in Alberta, hammering people relentlessly with ever more stringent restrictions is not necessarily the optimal approach. So we have done everything we can to try to protect the healthcare system, and we'll take whatever additional measures necessary to do just that.
Operator, can you please put through the next caller?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, this question is for the Premier. Case numbers are high right now. Pressure is building on the healthcare system right now. How come you're making an announcement about an announcement? Why are we waiting until tomorrow to announce more measures?
Well, we just announced additional measures last Thursday. We continue to observe the data over the ensuing days, and we are in discussions in the Departments of Health and Education, and Justice and Solicitor General are developing additional recommendations for consideration by the COVID Cabinet Committee. And the vaccine rollout that I'm announcing today is an essential part of our fight against the COVID-19. So the ultimate weapon in our fight against the pandemic is the vaccines. Today's another important step forward. There'll be another one, I hope, later this week. We may be proceeding to the full phase 3 of the Alberta vaccine program, which would be every adult Albertan. So we continue to move forward on the vaccine program as the most effective tool that we have.
Do you have a follow-up, Julia?
Yes, I do, and this will be for the Premier as well. You continue to implore people to follow the rules, and that's what you've been doing for many, many months now. Doctors say what was announced last week isn't enough to temper the third wave. You yourself are admitting that by saying we're going to see more measures tomorrow. And even though we're hitting record numbers now, the restrictions aren't as strong as they were in December. So with what you are planning to announce tomorrow, will they look like what we saw in December? And also, will they be provincial or regional? Because you have these provincial rules and these hotspots that we heard COVID can travel, people travel. So what can we expect?
So what you can expect is stronger measures. Those decisions have not been made. I anticipate announcing additional measures tomorrow. I'll remind you that less than a month ago, we put in place stronger restrictions across the province. And then subsequent to that, we've seen the secondary schools for a majority of the province move to online instruction. We layered on top of that a suspension of extracurricular youth activities, which has proven to be a source of transmission. And then additional measures were announced last week. So we continue to layer stronger measures on top of stronger measures. We saw that that was effective in November and December in flattening that curve. What we're dealing with now that is more challenging is, of course, the spread of the variants. We're particularly concerned about the emergence of the P1 variant, the so-called Brazilian variant. But what's also different is the vaccines. And I think it is important to point out that while the pressure in our healthcare system is building, and that we all have to do everything necessary to abate that pressure, that we have seen the ratio of active cases to people being hospitalized come down pretty consistently over the past couple of months. So we were at a total active case to hospitalization ratio over a 14-day lag period of 5.5 to 6% a couple of months ago. We now appear to be at more like 3.8% now. And in terms of ICU admissions, we've gone from about 1.4% of total cases ending in ICU admissions a couple of months back to about 0.8% now. So those ratios continue to come down, move in the right direction. And I think that's largely because we've been able to vaccinate people most vulnerable to severe outcomes. So we expect that to continue to go in the right direction. But in the meantime, we do have to flatten that curve.
All right, we have time for 2 more questions. Operator, can you please put through the next caller?
Next is Carrie Tate with the Globe and Mail. Go ahead, Carrie.
Hi, thanks for taking my question. Premier, I'm a bit confused, I think like a lot of my colleagues. I'm wondering, why do you keep taking these piecemeal steps? I understand that you don't want these wholesale restrictions, you value lives and livelihoods, but it seems like there's just these bit-by-bit steps and it's not having any cumulative effect. What's holding you back from doing the types of things that you're talking about doing tomorrow as one big package and fighting this with a full fight?
Well, again, I think that question and some others understate the degree, the stringency of public health restrictions we've had in Alberta for a very long time. I'll repeat to you that we can have on paper the hardest lockdown imaginable, and if a critical percentage of the population, if a large share of the population isn't following that, it doesn't matter. And I think it's pretty clear that with a public health policy very similar to our neighboring provinces, with growing numbers in Alberta, but shrinking numbers in BC and Saskatchewan, that there is a behavioral difference here. And that is something that we have to take into account in all of the decisions that we make. And so what we want is for folks to follow the rules, not rules for the sake of rules. So we have, that's why we've always taken the approach that restrictions should be a last and limited resort to maximize compliance and public buy-in. clearly what's happening right now cannot continue. And that's why we may be left with no tools left in the toolbox apart from broader, tougher restrictions that we have sought to avoid, but which may be necessary. So I hope that answers your question.
Do you have a follow-up, Carrie?
Yes, I do. Thank you. Respectfully, Premier, I'm still confused. If we have a behavioral difference, then why do you expect the same rules that are in, say, BC and Saskatchewan to have the same outcome in Alberta? To try something.
Well, that's why we may have to introduce additional measures, because we do know the broad majority of the population is trying to comply. And clearly we also have, as we announced last week, we've announced additional enforcement tools to address non-compliance by using sanctions, by basically telling people that they're not going to be able to, for example, get driver's licenses renewed unless they pay their fines. So we're going to use more enforcement tools. We'll be considering additional enforcement tools in cabinet tomorrow, and both on the enforcement side and the as well as the policy side. We're going to do whatever it takes. But you know, at the end of the day, what's required is broad public buy-in to the restrictions that are in place. And without that, as I said in my statement today, we've all got to be part of this solution. So it is, you know, this notion that a lot of these questions are that we should have in Alberta been on a rigid lockdown for months, like Toronto has been. It didn't seem to have helped them in their third wave. I frankly think that would have worsened the problem of non-compliance in Alberta.
Operator, can you please put through our last caller?
Final question is from Audrey Naveau with Radio Canada. Go ahead, Audrey.
Hi, Premier. Thanks for taking my question. I'd like to hear you in English and in French, as usual, on my two questions. You talk about enforcement, and you presented some measures last week to have people comply with the restrictions. I'd like to know if you would consider the measures that were suggested today by the NDP, for example. There were four, but for example, tripling the fines related to COVID-19 and also creating one specifically for those who obstruct the enforcement of public health restrictions. Is that on the table for tomorrow?
Yes, and you had a second question?
Yes, I'll ask after.
Okay, so the answer is yes. I saw that release, and our Justice Minister has been tasked with presenting additional options for enforcement, and I specifically asked him to take a look at the viability of those ideas. We don't look at any of this in a partisan lens, and if any of those are workable, we'll give them a consideration at Cabinet. I'll say the same in French. La réponse est oui. Notre ministre de Justice va présenter les politiques supplémentaires pour mettre en vigueur les mesures de santé publique demain, et je lui ai demandé à considérer les suggestions politiques de l'opposition officielle. Ça ne doit pas être une question partisane, mais nous sommes ouverts à n'importe quelle bonne idée pour avoir l'enforcement plus rigoureux.
And your follow-up, Audrey?
Yes. Also, last week you announced that the regions, municipalities that would go over 1,000 active cases per 100,000 residents could have a curfew if the municipality requests it. Why don't you, who has the information, who has the recommendations of Dr. Hinshaw and her team, why don't you take that decision? Why do you leave it in their hands?
Well, because this would require the cooperation of local authorities, including their local municipal police services. If we end up in a situation, and we're talking about a kind of exercise of state authority that I think is without precedent in Alberta history. This is very serious business, and I wouldn't want to run into a situation where the province is trying to impose that through municipal police forces against the wishes of the municipal government. You know, I'm sorry to say this, but there are many, don't have a count, but I'm told dozens of municipal governments across the province that apparently have issued various kinds of motions publicly opposing the public health restrictions that are already in place, and in some cases inviting non-compliance. At least I've been informed of that by members of cabinet. And this is another part of the challenge that we face. So it would, I think, be functionally virtually impossible to enforce a curfew in a situation where there was the active opposition of the local municipal authority. I'll try to say that in French. Pour dire que, écoutez, nous parlons d'un outil qui est très sérieux, sans précédent historiquement en Alberta, je crois, et c'est effectivement impossible de mettre en vigueur une telle politique sans l'approbation et la coopération des autorités locales, y compris évidemment les forces policières locales. Et c'est la raison pour laquelle il faut coopérer avec les municipalités. À cet égard, je suis très inquiète à voir certains conseils municipaux qui ont adopté les motions qui s'opposent aux mesures politiques en place en Alberta. Et je suis informé que même certains conseils municipaux ont exigé leur population et leur business de ne suivre pas les mesures de santé publique. Ça m'inquiète énormément, évidemment, mais c'est la raison pour laquelle, quant à l'exercice d'un pouvoir si sérieux, il faut avoir la coopération du gouvernement municipal. Thank you very much, everyone.